My name is Kara Vandervliet. I am an oncology nurse at the Sherman Cancer Center at Elmbrook Hospital. I'm also a certified exercise specialist in cancer exercise, along with Kayla. So for this program, every week when we meet on Mondays, our first 15 minutes will be an education portion, and then the last portion of the day will be the exercise portion. So today we're going to talk about healthy eating and active living, and specifically benefits of exercise in cancer survivorship. So research shows that for most cancer survivors, exercise is safe and beneficial, and survivors means anyone in the phase of from diagnosis all the way to post-treatment or even during treatment. Each cancer survivor has had a unique cancer experience, so a unique cancer treatment, and your own unique body prior to cancer, so each person needs a unique cancer program. Different things that we consider: muscle imbalances, we always watch for your heart rate, and then risk for lymphedema, especially with breast cancer. Other things that we consider is how you feel when you think of exercise. A lot of people kind of dread exercise, and we'd rather get past that and get to something that you really enjoy and can kind of continue to do in your life from now on. So finding something that you enjoy, whether that's walking with a friend or listening to music while you're doing it, or watching a show on the treadmill, changing it up, being outside is something that really you enjoy and you feel refreshed from, so including walks outside or hikes. Dancing, we're not going to do that here, but that's always something fun that people like to do. So important just to find it something that you really enjoy and find a time that works best for you. So some evidence-based benefits of increasing your exercise and including that in your lifestyle is it helps with fatigue. And as a cancer nurse, that's one of the things I talk about when I'm doing the teaching before treatment, is that what we always say to do if you are experiencing fatigue is to actually exercise or get some activity in. It kind of sounds counterintuitive, but really if you keep up with your lifestyle and your basic routines, it helps to combat that fatigue and prevents it from happening. It also decreases risks or effects of chronic conditions like osteoporosis, heart disease, diabetes, arthritis, all of those things. But weight-based training specifically is really good for strengthening your bones and preventing osteoporosis, which is very common in breast cancer survivors especially. Decreases depression and anxiety. So any kind of activity releases those feel-good endorphins, even though it might not feel great while you're doing it. Afterwards, usually you don't ever say that you regret exercising. So usually feels pretty good, and releases proteins and growth factors that cause nerve cells to grow and improve brain function. So just think about, I like to think of it as it increases blood flow kind of everywhere in your body, and it also increases blood flow in the brain and helps the brain just kind of wake up a little bit. So usually exercise doesn't make you feel more lethargic, it makes you feel more energetic. Improved body image and self-esteem, and improved sleep. And then a couple other ones, it helps reduce side effects from surgery, radiation, chemo, and hormonal therapy. So it helps with range of motion and tightness, especially after surgery or radiation. And like I was saying before, loss of muscle and bone strength is a side effect to hormonal therapies. So that's why we incorporate the weight resistance training. Strengthens your immune system, helps with breast cancer-related lymphedema, especially when we're doing those lymph drainage exercises. Boosts your memory because you're getting more blood flow in that brain. And then regular exercise after diagnosis is shown to increase survivorship by 50 to 60%. So it decreases your risk for breast, colon, prostate, and decreases your risk of death from cancer. There are some guidelines and recommendations that the American Cancer Society has out, And they say to avoid inactivity and return to normal daily activities as soon as possible after diagnosis and treatment. And so when it says as soon as possible after diagnosis, I like to incorporate it with patients that are undergoing treatment if possible, if they can. Not maybe a super hard workout, but something, calm and gentle that they can incorporate while they're going through treatment as well. So, and during treatment and after treatment. Take part in regular physical activity, start slow, and build up the amount of physical activity over time. So they recommend that you build up to 150 to 300 minutes of moderate activity each week, which seems like a lot. But if you think about half an hour a day times 7, that'd be 210. So you'd kind of be in there if it was just half an hour a day. Exercise several times a week for at least 10 minutes at a time. Include resistance training at least 2 days per week, and do stretching exercises at least 2 days each week as well. There's 4 different kinds of exercises, endurance or aerobic, and we'll kind of talk about each of these specifically. So those are exercises that increase your heart rate and breathing and kind of build that muscle of your heart. Strength or resistance exercises, which are muscle contractions against outside resistance or weights that result in increased strength, power, size, and endurance of the muscles. So think of those as building up the muscles, but that's also strengthening your bones. Balance strengthens the muscles that help keep you upright, improving stability and preventing falls in the future. And flexibility stretches your muscles and helps your body bend and move easier. And as we get older, we get tighter. So we want to keep including those in our routines as well. So endurance or aerobic exercises would be walking on a treadmill, walking outside with your friends or your dog, doing yard work, dancing, swimming, which we have to say if you have a port or a PICC line or a feeding tube, any kind of catheter, please do not swim. And then also if you are still compromised, have a compromised immune system, we say avoid swimming if possible. Cross-country skiing, tennis, all those sports, biking, boxing, step aerobics, rowing or kayaking, rock climbing, or water aerobics. So really, endurance and aerobic exercises, there's a huge variety. It's whatever you do that can get your heart rate up, even vacuuming the house or going up and down the stairs at your house doing laundry. I count that as a workout some days. So anything that can get your heart rate up and keep it up for a little bit of time, and it doesn't have to be 30 minutes all in one chunk. It can be 10 minutes in the morning, 10 minutes in the afternoon. It can be here and there. Strength and resistance exercises. Swimming is in this one as well because you're swimming against the water, and so that is actually using resistance as your strength training. Pilates, free weights and lifting weights with weight machines, resistant bands, yoga, or aerial fitness, which is a cool one. You can be in a hammock or a swing, and then patients can kind of do postures that normally you wouldn't be able to do on the floor. Chores around the house, carrying groceries, vacuuming, raking leaves, paddleboarding, rock climbing, and water aerobics again. A lot of these kind of can go back and forth between the cardiac aerobic exercises and strength. So yeah, lots of fun ones listed there. Balance is more Tai Chi, yoga, Pilates. So those are all going to be ones that are going to focus on your core, kind of using those muscles to keep you upright. And as we age, we kind of are slumping down more. So any of those are good. And then lastly, for flexibility, again, yoga, Pilates, and stretching. Takeaway points, we are all unique and all starting from a different point. So follow your physician's recommendations and restrictions. Start slow and progress on your own time. You don't want to start, if you aren't exercising at all, you don't want to start and do like 60 minutes of a super hard workout. That would be not ideal, and you would probably be more sore for multiple days afterwards than you wouldn't even do anything then. There are many benefits of regular exercise. So studies link regular exercise with remission and decreased chance of cancer reoccurrence, along with preventing new cancers. And there are many different forms and types of exercise. Find the exercises that you like and to help you stick with your exercise routine. And diversify your workouts. Do something different. Keep it fresh so you don't get bored. And recognize and reward your achievements. Set some short-term and long-term goals. They don't have to be giant. It's not like we're going to go run a marathon at the end of this, but just set some goals so that you can kind of reward yourself at the end. And then some other questions to think about. We won't get any feedback back and forth on this today, but how does this information make you feel? Some may feel hopeful that they can do more, and some may feel frustrated or even angry that they're told to work harder when they're already exhausted. And how do these feelings affect your behavior going forward? Why did you initially register for this program? And when you think about increasing your physical activity, what small changes can you start to incorporate into your daily routine? And not everyone will feel motivated to do the standard exercise routine of going to the gym or walking outside. If you feel this way, what are a few things you enjoy that relate to one or multiple different types of physical activity? For example, if you enjoy spending time with your kids or grandkids, you can play some active games with them, and that would count as exercise. So thinking outside the box a little bit when it comes to exercise so that you can enjoy it and not feel like it's a burden.